careful coming down here, huh?
Well, there are several major controversies swirling around the health care bill making its way through Congress. The Senate just getting into the amendments process, where the bill could get decorated with all kinds of goodies. So far, everything President Obama and other Democratic leaders want remains on the table, but lots of proposals will have to change in the coming weeks. So what is this final bill going to look like? Let's talk about it with Ron Bonjean. He was communications director for former White House Speaker Denny Hastert. Julian Epstein is a Democratic campaign consultant. Welcome to both of you. Ron, let's start with you. You've seen how the legislative process works, taking a look at the Senate side. As they start offering amendments, what's going to be in, what's going to be out?
Yeah, well, it's really clear that Senator Reid's bill is going to have to be changed. There is no way that it's going to pass intact. In fact, you know, the biggest thing out there right now is the public option. You know, Senator Lieberman on Sunday said he's not going to vote for a public option. He won't even support a trigger.
And you've got to have Lieberman's vote if you want to pass this thing. Is that right?
You got to have Lieberman's vote. Senator Olympia Snowe, she did support a trigger option. You know, however, Senator Reid did push her aside and introduce his bill with just a public option. So you might have to give some more to her. You know, this is all about the overall cost of the bill, too. There are no Thanksgiving sales for health care reform, and the American people aren't buying it. That's because it's too costly, it cuts Medicare, slashes benefits, and will hurt small businesses and destroy jobs.
All right, Julian, you just heard it. He says this thing will not pass with government-run insurance, the public option. What do you think?
Well, first of all, just to correct the record, this actually cuts the deficit, and it cuts out a lot of the Medicare waste. And I'd be surprised to hear the Republicans defending Medicare Medicaid waste.
Julian,
secondly,
cuts
well,
Medicare.
I think there's just there's an abundant amount of evidence about waste, fraud, and abuse in the Medicaid system. Republicans are defending that. But secondly, Ron, if I could finish the point, I didn't interrupt you.
Yeah, Ron, let him talk.
I really didn't interrupt you. Secondly, I think that you know, clearly all eyes are on the public option right now. I think that there is a game of chicken that is consistently played on major bills like this in the Senate, where the liberals and the moderates all try to say that they won't vote for something unless they get what they want. At the end of the day, something will get passed here. My guess is what's going to happen is that the Senate leadership will move towards the Maine senators, who either want, the two senators from Maine, who either want a trigger or want some type of opt-in provision, and I think that will happen. Now, the liberals in the House will rebel against something like that, but I think at the end of the day, the liberals in the House will come home. So I think you'll see the public option will stay in there, although it will move to the political center or even to the political right. At the end of the day, you will get something passed because the current system is intolerable, and this is actually going to lower premiums. This is going to be good for small businesses. The Business Roundtable has come out and said this is not only going to be deficit neutral, but this is going to save small businesses as much as $3,000 per employee.
All right. Let's give Ron a chance to respond.
Yeah, no, the Department of Health and Human Services said that health care reform will cut Medicare to the point where hospitals and nursing homes will not be able to take care of senior citizens. You know, in fact, I mean, this bill is so costly that on top of it, there's going to be a vote to increase the public debt in the Senate during this whole debate. That's going to throw it off track, I think. You know, it might get through the process. We might see a health care reform bill next year at some point. But right now, it looks really unlikely Senator Reid's bill will stay intact. And we'll just have to see what happens.
Ron, if as you say, Ron, if there's that much waste in Medicare, Medicaid, why not cut it out right now?
Well, you know, there is waste in Medicare and Medicaid, but not to the amount that President Obama and the Senate and the congressional Democrats want to cut.
Ron,
We're talking $500 billion.
I meant to address that to Julian, and Julian, let me give you the last word.
Yeah, nearly every single expert that has looked at the Medicaid and Medicare system has said that while Medicaid and Medicare and public administered systems operate more efficiently than the private market, which is non-competitive right now because of all the concentration, they have nonetheless said that things like fee-for-service as opposed to bundle payments is enormously wasteful. Medicare Advantage is enormously wasteful. Democrats are looking for reform here and for universal coverage. Republicans are not only defending the status quo, they're also defending an enormous amount of fraud, waste, and abuse in government welfare systems, which is an extraordinary turn of events.
Julian Epstein from the Democratic side, Ron Bonjean from the Republican side. We'll keep debating it. Thank you.
Thank you.
Thank you.
Well, bye-bye Butterball. Courage in Carolina, you are the lucky two turkeys that are about to get a pardon at the White House. That's coming up next.
Once there was a sad stretch of road
drivers just couldn't stop in time. But along came the Michelin Man, who reminded them the right tire changes everything. With better tires in place, that sad stretch of road wasn't so sad.